What's up, y'all? It's your girl Aniyah and welcome back to my channel. Today I'm giving you guys what you have asked for and been asking for like weeks and weeks now. Today we are going to do a day in the life. So as you guys know, I do work with COVID response. I am giving COVID-19 vaccinations. I work with a company called Wild Health, and we are a company filled of healthcare professionals of all different types. We got PAs, we got doctors, we got pharmacists, we got CNAs, we got medical assistants, we have pharmacy techs, we have phlebotomy techs, we have phlebotomists, we have everybody. So all of us have came together to help vaccinate the Commonwealth of Kentucky. Our company does it fast, we do it quick, we go into big areas, big densely populated areas, and we also go into smaller, more rural areas and help vaccinate Kentucky. So that is what you guys are going to be seeing today. Today I'm going to be going into a site here in Lexington, and it is a YMCA. So you're probably thinking, why would you get a vaccine at a YMCA? But we just go into these random small areas to make sure that people have access to this vaccine. So today it is at a YMCA in Hamburg here in Lexington. So that is what I'm going to be showing you guys today. Hopefully I'll be able to show you guys a lot. Obviously I won't be able to show too much just because I can't show the patients or any of their information, obviously. So but I'll show you guys what I can, and you guys can get a dive into a little bit of what I do. So if I can get a video of me giving a shot to somebody, I will. If I can't, it just depends on what the patient is comfortable with, so we'll see. Go ahead and hit that like button, hit that subscribe button, and put a comment down below of what you guys want to see from me next. If you haven't already, enter my giveaway. I am giving away a personalized study guide for anybody who has taken the medical assistant exam anytime in the near future. But for me to give away that study guide, we have to hit at least 400 subscribers for me to even send out one study guide. So you guys, welcome back to my channel. Thank you guys for tuning in, and let me know what else you guys want to see from me, okay? Other than that, let's get into the video.
I promise you that you'll never meet another person as mentally tough as you. He hasn't, and he never will.
Alright y'all, so I'm on my way to work. Not really much to see here. So just to give y'all a little synopsis of what goes on at my job before we get in there. So normally whenever we go to sites, it's very random and in very random locations. So we always have to set up the site when we first get there. When we go to sites, they normally have vaccinators, check-in people. We have pharmacists that dose and dilute the vaccines. We also have pharmacy techs that will help dose and dilute. I can help dose and dilute too as well. It is in my scope of practice as a medical assistant. So sometimes I do draw up COVID-19 vaccines as well. We'll have a site leader who will talk to if anything goes wrong. And yeah, that's pretty much the team. We have vaccinators, check-in people, we have a pharmacist, and we have somebody that assists the pharmacist most of the time. So how it kind of works is we set up our site to where there's minimal contact. So if you were coming to get a vaccine, you would come in, follow a line, and we would have kind of like some tables set up, and at the table it would normally be like one person, and they would be, most of the time they're the check-in person and the vaccinator, so most of the time we're doing both jobs. The only time it was separate was when we were at the University of Kentucky giving vaccines, and that's when we had a whole separate thing for check-in. Like we had people who only did check-in, and we had people who vaccinated. So but at these smaller sites, normally the vaccinator and the check-in person are the same person, so you'll see one person for your entire kind of process, I guess you could say. So we'll come in, we'll set it up, and at the table we'll have all the things we need to give the vaccines. Sorry y'all, this is so dangerous. I should not be doing this at all, but I am. So we'll have alcohol pads, we'll have cotton swabs, we'll have things for COVID-19 testing, swabs for the COVID-19 testing. We do rapid and PCR testing. We'll have the stuff for that. We'll also have the vaccine, the actual vaccine itself. We'll have band-aids. We'll have printers to print off barcodes. And we'll have laptops to do check-in stuff. And gloves and hand sanitizer as well. We'll definitely have there too. So, sorry, I don't know what... Oh my God, they're doing construction right here. Oh my God, it's killing my vibe, y'all. It's killing my vibe. Okay. So yeah, that's kind of like an example of some things that we'll have at the table. I may be leaving some stuff off, but that's kind of like the general overview of what we'll have at the table. And then we'll just wait. We'll see how many appointments we have for the day. The appointments will come in. We'll check them in, and then we'll talk to them a little bit about some of the side effects of the vaccine that they may see. And we'll also talk to them about what to do after they get the vaccine if they do have side effects. We'll talk to them about their health history. You know, certain allergies will make you more prone to adverse reactions than other ones. So bee stings and shellfish are typically the things that we like to watch out for when we give a vaccine. Or if you have any other kind of allergy and you have any kind of anaphylactic shock to the allergy, we like to watch out for that. So anyone who gets a COVID vaccine has to wait a standard 15 minutes anyway, but if you have any severe reaction or an allergy like bee stings or shellfish, we will make you wait a little bit longer just so we can make sure that you don't have any adverse reactions to the vaccine. So yeah, hopefully that was a good overview and hopefully it wasn't confusing. But after that, after talking to the patient, we will give them the vaccine, give them their COVID-19 test if they opt into it. And then after that, we'll send them to our waiting area where they'll have to wait for either 15 or 30 minutes. And after they wait their 15 or 30 minutes, they will be free to go. So yeah, that's kind of like the process. I'm going to show you guys what the stuff kind of looks like. Like I said before, I don't know if I'll be able to actually like show me giving a vaccine just because, you know, I don't know who will be comfortable with that, but I don't know, we'll see. I'll check back in with you guys when I get to work. Right, you guys, so here we go. So right here is what you would see if you were coming into our clinic to get a vaccine. To the left, we have our waiting area for after you receive it. And directly in front of me, you will see our supplies that we bring in every morning and the pharmacy table. At the pharmacy table, we have the pharmacist and the pharmacy tech normally. That is where they sit and dose and dilute the vaccines. Right here, we have a couple of vials of COVID-19 vaccines that are waiting to be drawn up. And now you will see the two tables we have set up for vaccinators. So you can briefly see we have like some sharps containers. You might can see the trash can, alcohol pads, laptops, different things like that. You can see we have two chairs, one for the vaccinator and one for the patient. We're going to get a closer look up on this table now. Here's the laptop. We have our tubes that our COVID-19 tests go in. After we swab the nose, the rapid test goes in that one with the blue cap, and the PCR test, which is the more accurate test, goes into that one on the left. We also have our printer here, we have some band-aids, and we also have some hand sanitizer, which is what I'm touching now. You see that we have some stickers. These stickers are what we put on the COVID-19 vaccination cards. And we also have some Wild Health stickers that go on there as well that tell us that we are the ones who administered the vaccine. So now we have our software that we use to check people in for the vaccine. I'm not going to be able to show you guys who is scheduled, obviously, but I can show you guys some of the questions we asked. Have you had any other vaccinations in the past 14 days? Are you pregnant? Have you ever had any adverse reactions to vaccines? Do you have any allergies? And have you had COVID-19 in the past 14 days? Of course, I told you guys we look for shellfish and bee stings as allergies. If all that checks out and it's good, we move on to the vaccine administration page, and that is basically where we show or document what arm we're going in. In this man, I'm going in his left deltoid. So you can see I'm pretty quick. I swiped him with some alcohol and then let it air out a little bit and then just tick him with the vaccine. It may seem a little nerve-wracking at first when you do it your first time, but after you do it a couple of times, it really is just second nature, you guys. So don't be nervous about that. Most of the people that I give vaccines to say that it's super quick and it was super easy and didn't hurt. A good way to gauge is if you have blood, and if you do, then how much blood do you have? Typically, when you have a clean administration that goes straight into the muscle, you won't have any blood. You can kind of gauge it off of that, but there are some people that are just bleeders in general. So regardless of how good the vaccine is or the administration is, they're going to bleed regardless. People that are on blood thinners really will bleed. A lot of them will even squirt. So it really just depends on the previous health conditions. Alright, you guys, so I actually was sent home early. I told them that I would be the volunteer to go home early because I have an 8-page paper due tomorrow night and I have 2 pages. So I told them if they need somebody to go home, I definitely want to be the one to go home because I have an 8-page paper and a project due tomorrow. Don't ask, y'all. I don't have my life together. It's graduation week and I've been taking grad pictures, doing all types of stuff, trying to plan, trying to get assignments in. It's just been crazy. But anyways, my job was nice enough to go ahead and send me home. But I do think I got some good content for you guys. I was able to record myself giving a vaccine, so hopefully you guys enjoyed that. And hopefully I'll be able to show you guys more. That's really all there is to my job right now. We do also travel, so maybe I can give you guys a travel day in the life, because next week I'm going to be going and traveling to a different county in Kentucky, so you guys can see kind of like how those assignments work and how they're different from just the normal assignments I do here in Lexington. So if you guys enjoyed this video, go ahead and give it a thumbs up, subscribe to my channel, join the party, you guys. We are becoming medical professionals. Even if you don't want to become a medical professional, hopefully you just like me and want to keep on watching my videos. So yeah, go ahead and subscribe, join the family, and leave a comment down below if you enjoyed this video and want to see more like this, okay? Thank you guys for watching. You guys have a great rest of your day.